Hi, I'm Erin, and I'm going to be inserting a nasogastric tube. So I would go into the room, use two patient identifiers, explain to them what I was going to do, and then I'd ask them about assess their level of consciousness. I would assess their bowel sounds, make sure there's bowel sounds. I'd ask them if they've ever had a nasogastric tube before, ask them about their allergies, and then I would assess their nares. And I would have them close each nostril to see which nostril had better airflow, so I know which nostril to put the nasogastric tube up. And then I would clean the top of their nose. Because we're going to be sticking tape on it, so make sure that their nose is clean. And then I would perform hand hygiene and put on my gloves. And when you go into the room and you're about to do this, make sure that they are placed in high Fowler's position as well. So first you want to measure it, and when you measure the nasogastric tube, you want to do it from the tip of the nose around their ear to their xiphoid process.
Put this up just in case they vomit.
And it's about at 55, and then you would coil it up so it's easier to insert. And then when you see that it's at 55, you want to mark it with tape as well, so you know when to stop inserting it.
As far as it goes in on here, since it's hold that extra stuff.
So you mark it, give them a towel.
Check the pH to make sure that it's less than 5, that means I'm in the stomach. Then after I get a chest x-ray that's inflated.
Give them the emesis basin because it might stimulate their gag reflex and they might have to vomit when in the process. Then you want to get your lubricating jelly ready. And you're going to explain to them before you start inserting it that they're going to stick their head back, and then once it hits the back of their throat, then they're going to stick their head forward, and they're going to take sips of water and swallow. And every time they swallow, I'm going to stick it back a little bit further. It's going to help them and kind of relieve the pain when they swallow.
You can just cut the last.
I'm sorry, I ruined it.
So I'm going to have Maggie here as soon as it hits the nasopharynx. I'm going to have her assistance, and she's going to give him the water.
I was like,
okay?
You're like,
so let them know that you might feel like a burning sensation as soon as it goes in, when it goes in. So tilt their head back.
I'm sorry. Okay.
Alright, ready?
Yeah. Okay, so now taking out an empty tube, I want to make sure
And hit the nasopharynx, so tilt forward and drink.
I'm going to unhook the suction
And swallow.
and float this back up. Put this up here. Unpin it from the patient's gown. Take the tape off the patient's nose. So I'm going to take a deep breath in.
Alright, it's all the way in. And you want to tape it to their nose
Up in here and wrap it up.
so it doesn't move.
That's it.
On to the next one. On to the next one.
And when you tape it, you want to rip it all the way, not all the way down, but so you have a little bit.
Some weakened parts.
So you have a little bit of, don't cut it all the way, and then you want to buddy tape it so you fold the ends of it, so it's easier for the person that's removing the tube to take it off. and check the placement of the music ester tube. You want to do, you want to aspirate it, and you're going to use the gastric contents to do the pH, and you want the pH to be about 5.5 or below. And then you're also going to do a chest x-ray, and just to make sure that it's in the correct place. And then once you have gotten that it's in the correct place, you want to attach it to their gown. And then you want to set it up for suction. So when you set it up for suction, you want to make sure that it is on low intermittent suction. And so you turn it on, and then you attach it here. And on here it says to patient, so you know which one it would go to. So you attach it on here, and then come over here and attach it. And make sure it is on low intermittent suction. Alright, in my next video I'll do irrigation and removing the NG tube.